everyone. My name is April Rain, and I'm so excited to welcome you back for episode 2 of Healthcare Voters' new web series, What's at Stake, as we explore the pressing healthcare questions on your minds right now. In episode 1, we heard from policy experts, organizers, and activists about what's at stake for the millions of Americans who depend on Medicaid for access to quality, affordable health care, and those who are being left behind by states' refusal to expand Medicaid under the Affordable Care Act. Today, we're diving into one of the most pressing issues facing our country, the organized crime of Big Pharma's influence on lawmakers. Big Pharma's formidable influence on lawmakers in Washington, D.C. is the country's worst kept healthcare secret. Between having more lobbyists per member of Congress than any other industry, planting the very same CEO who infamously led Eli Lilly's price gouging of insulin as the top healthcare official in the country, and mega corporations profiting off of the taxpayer-funded hunt for a coronavirus vaccine, it's time for the American people to learn the full truth about what's at stake during this pandemic. With Congress in its pockets and the White House at its beck and call, the pharmaceutical industry has little incentive to make quality medicine, including the COVID vaccine, accessible to the people who so desperately need it. Today, we'll hear from some really incredible and inspiring people about how folks are agitating to hold Big Pharma accountable to making medicines and vaccines affordable and accessible. I'm excited to introduce you all today to Margarita George, who is the campaign director for Lower Drug Prices Now, Sarah Skipper, who is a patient advocate in Indiana, Tarek Khan, a family nurse practitioner in Pennsylvania, Caroline Coram, a registered nurse and patient advocate in Virginia, and Zain Razvi, a law and policy researcher with Public Citizen. But before we hear from these amazing people, we're going to hear from an actual American hero first. We're so excited to be joined by the one and only Representative Ilhan Omar from Minnesota today. Representative Omar is a champion fighting for the American people in Congress, and she has joined us today to talk about what's at stake this year with Big Pharma and the need for affordable medicines and vaccines. Representative Omar, I will hand things over to you.
Thank you so much for that warm introduction, April. I am really excited to be here with you all for this very critical conversation. As the COVID crisis spreads illness, death, and catastrophe around the world, nearly every corner of the economy has been impacted. Everyone, that is, except the pharmaceutical company. While millions struggle to put food on the table, provide for their families, and even keep a roof over their head, Big Pharma is raking in record sales and profits. The truth is that profiting off the public good is also business as usual for the pharmaceutical industry. Since the 1930s, the National Institutes of Health has put $900 billion into research that drug companies then use to patent brand-named medications and profit. Every single drug approved by the Food and Drug Administration between 2010 and 2016 involved science funded with tax dollars through the NIH. Taxpayers spend more than $100 billion on that research. Drug companies also profit from patents, which gives them monopoly power for their on-patent products. These patents ensure that prices remain high by reducing competition for 20 years after the filing date, so that they can make it harder for people to afford medication. As pharmaceutical industry profits increase, everyday Americans are not receiving anything close to a fair return on their investment. The profits have funded huge bonuses for drug company executives and aggressive marketing to consumers. High costs of prescription drugs has forced many Americans to take drastic measures, including foregoing taking their medications as prescribed, or even traveling outside of the country in order to save on their medication. In 2019, Center for the Disease Control and Prevention study found that 11.4% of adults between the ages of 18 to 64 did not take their prescription drugs as prescribed in order to reduce how much they spend on their medication. And in Minnesota, we had a personal case with young Alex who was rationing his insulin and lost his life because of that. But we all know that this doesn't affect us all equally. Price gouging by pharmaceutical companies is one of the root causes of racial health inequalities in the United States. Pharmaceutical price gouging disproportionately impacts and affects Black and Latinx patients across insurance status, age, disease type. Black and Latinx patients report higher rates of medication rationing, foregoing or delaying filling their prescription, even skipping dosages or reducing dosages below the prescribed amount due to cost. Even before the current pandemic, medication rationing due to inflated prices was contributing to unconscionable levels of preventable disease and death in Black and Latinx communities. President Trump ran on a promise to stand up to the pharmaceutical industry and lower prescription drug prices, but he has refused to actually drive down prices while at the same time filling top spots in his administration with industry insiders. This is a crisis. It's a crisis that's impacting Congress, and it's a crisis that's impacting this administration. And we bear the burden as the American people. We need real action and not window dressing. Last year, we took a drastic action by passing the Elijah Cummings Lower Drug Costs Now Act, HR 3, and move. And now we have to work towards a move to Medicare for All system to guarantee healthcare and cap the cost of prescription drugs for all Americans. This is something that is going to take all of us to have more clarity and courage to address. Thank you all for having this conversation, and thank you for including me.
Thank you so much, Representative Omar, for taking the time to join us today and sharing your perspective on the organized crime of Big Pharma. Since we have you here, I'd love to ask your perspective on the executive order the Trump administration announced a few weeks ago and finally released the text of this week. A few weeks ago, Trump announced that he'd issued an executive order tying domestic drug prices to the International Drug Pricing Index. Now, you and I both know that the Trump administration is fully aware that the only real way to really lower drug prices for the American people is to give Medicare the power to negotiate with drug corporations, the way it already does on behalf of veterans. Can you talk to us a bit about how this executive order differs from legislation like the Lower Drug Costs Now Act and the ACA Enhancement Act that passed in the House?
Yes, I mean, we did precisely what you were just saying, because we know that's the way in which we can affect the cost of drugs. In December of 2019, the House Democrats passed their signature drug pricing bill, the Elijah Cummings Lower Drug Costs Now Act, HR 3. The bill will cap drug prices and allow HHS to negotiate prices down even lower. But it is an election year, and the administration, instead of working with us in getting that bill passed, and urging the Senate and Mitch McConnell to take it up, they've rejected it. Instead, they're offering a very toothless executive order that falls short on delivering real results. Because what we need right now is a solution, which is what our bill offers. We need to make sure that HHS is provided with a mandate, an authority, and a tool to reducing the prescription drug costs, and make sure that there are real protections put in place so that Big Pharma can't manipulate the system and get away with murder as they have been for so long.
Thank you so much for that explanation, Representative Omar. We will definitely be checking out the Lower Drug Costs Now Act and the ACA Enhancement Act as it hopefully moves through the Senate. Thank you for joining us today. I'm now excited to kick off our next segment of the show, during which we'll hear from some amazing advocates about the fight to hold Big Pharma accountable for its wrongdoings and what the path toward a just healthcare system looks like. I'd love to introduce Sarah Skipper, a patient advocate in Indiana, Tarek Khan, a family nurse practitioner in Pennsylvania, and Caroline Coram, a registered nurse and patient advocate in Virginia. We'll start with a general health question for everyone. What makes you a healthcare voter? I'm going to ask you, Caroline, first. Caroline, you may be on mute still.
Am I unmuted now?
There you go.
Okay, great. Well, healthcare is a top priority for me. So I am very pleased to have a chance to support the activity and the issues that are being promoted through Healthcare Voter. Should I tell you a little bit more about my situation, or you want to check in with everyone else first?
No, I'd love to hear more about your personal stake in this, right?
Okay. Well, I am deeply involved with the metastatic breast cancer community. And metastatic breast cancer, for those who don't know, is cancer that has spread beyond its original site, taken up residence in another part of the body. It is treatable, but it is not curable. So the metastatic breast cancer community, all of us being treated for metastatic breast cancer, rely on very expensive drugs to stay alive, quite frankly. And frequently they're new drugs, they're very expensive drugs. And so this is an issue that we deal with constantly. The lack of and the inconsistency about healthcare in this country is a real problem for the metastatic breast cancer community. We frequently talk about financial toxicity and its effects on us and our families and our communities. Many people end up in medical bankruptcy because their bills are so outrageous. And it's a constant struggle to figure out how you're going to deal with the cost issues surrounding healthcare. And usually, for most of us, the largest piece of that is the drugs. It's a pretty tight-knit community worldwide, metastatic breast cancer. And what we consistently hear from our compatriots in other parts of the world is, I can't imagine trying to fight this disease and worry about how I'm going to pay for it at the same time, because in other countries, they just don't have this issue. And it's really because of the rules that are in place, the more comprehensive healthcare system that they have, the reliable healthcare, and they have mechanisms in place to allow them to be treated when they get sick, which is what a healthcare system really should do.
That's absolutely right. I mean, if you are fighting a chronic illness, you shouldn't also be fighting the pharmaceutical companies to help you pay for the drugs you need for that illness. Sarah, I'd love to go to you. What makes you a healthcare voter?
Well, I have been type 1 diabetic since I was 5 years old. So health has just been a part of my life. So just making sure and ensuring that, now that I'm older and seeing like how expensive it is to be diabetic, and just like my own personal struggles and my family struggle with affording insulin, not just for me, but for my younger sister as well. it just came to a point where I felt like I had to speak up, and I knew that I wasn't alone, and we weren't the only family unable to, afford their life-sustaining medicine. So I think what makes me a healthcare voter is my tenacity and wanting to fight and be a voice for people who feel like they don't have a voice, or the voiceless people who have unfortunately perished due to pharmaceutical greed.
I love that. Your tenacity is really inspiring, and in the fact that we're talking about, how do you keep going every day and fighting a system that you may not be able to see, but that absolutely affects you with your everyday life. Yeah. Tarek, please chime in for us with what makes you a healthcare voter.
Sure. Thanks, April. So I'm a nurse practitioner here in Pennsylvania, and I work predominantly with patients of color, patients who are low income, and these are precisely the patients that are most at risk if this election goes the wrong way. I believe that healthcare is a fundamental human right, and if that we consider ourselves a civilized human beings with a functional government that we elect, we should be able to provide healthcare for everybody. In 2008, as you see behind me, this Zoom captures everything in my room. I campaigned hard for Obama, and my big issue was increasing access for affordable and quality healthcare. Sure enough, when the Affordable Health Care Act passed, the ACA, Obamacare, our uninsured rate at our health center went down from 25% to under 10%. And now here it is, 2020. I'm a healthcare voter again because we're in a pandemic that has cost the lives of 200,000 Americans in 6 months. And we need the guidance of the federal government to help us recover from it. We also need a plan to get out of the pandemic, and that includes national leadership. It also includes a vaccine that we can feel is safe. And the president's record currently on the pandemic, I think it speaks for itself. A poll just came out about Americans' trust in the FDA and pharma, and less than 1 in 10 Americans have a great deal of trust in the FDA or drug companies. So I'm going to be blunt, and please excuse my language, but we're going to continue to get our ass kicked by the coronavirus if we don't elect a new president.
I think that's right. The science that the administration doesn't believe in is absolutely right there for us to see. And in fact, you're giving us, hard numbers, going from 25% to 10% under the Affordable Care Act means that it's working for people. Tarek, I'd love to stay with you for just a second and ask, what are some of the lesser known issues you're aware of in this fight against Big Pharma and industry price gouging?
Absolutely. There's a bill actually now that Representative Omar actually wrote to protect. It's called 340B. It was actually passed by George H.W. Bush in 1992, just to show how much things have changed. 340B basically means that patients get huge discounts on their medications. So if you're a patient and you go to a hospital that sees a lot of uninsured patients, if you're a patient that goes to a health center that sees a lot of uninsured patients, you're going to get a huge discount on your drugs. That's something that pharma legally has to do. It eats up about 1% of their profit. Pharma does not like that. It eats up 1% of their profit. As a health center, that 1% it makes up for our health center makes up about a third of our budget. Those small savings, and I can tell you, I had a patient. The fact that we're able to get discount drugs. I had a patient newly diagnosed with diabetes, and he went to his local pharmacy, and he was scared. He was really tired because he had been in the hospital for a while. They told him it was going to be $458 for a 25-day supply of his medicine, not even for a full 30-day supply, right? So they made some phone calls, and they got that down to $335 for a 25-month supply, for a 25-day supply. He paid the money. He saw me at the health center. I was able to get at our 340B pharmacy, because the pharmaceutical companies have to give that discount. I was able to get that down to $25 a month. So basically what he was able to get from the local pharmacy for 25 days, he was able to get from this 340B program for a full year. And pharma is basically trying to undermine that program. And they're also trying to get patients' information. They're trying to get, all of the data. And they're basically trying to take those discounts away. Finally, they're trying to make it, this is pharma, they're trying to make it so that if you have a health center like ours, we have 5 health centers in Philadelphia, they would actually make it so that you could only go to one pharmacy. So Philadelphia is a big city. So if you lived in Southwest Philadelphia and you go to our clinic there, instead of going to the pharmacy there for the discount, you have to go all the way up to Northwest Philadelphia, which is 3 buses for some patients, because pharma doesn't want to lose that money. Basically, that's the 340B program that pharma right now is trying to undermine. I would like to see, as an optimist, I would like to say it's not because of the pandemic, but I'm skeptical. The last thing I'll say, that if this 340B program is undermined by pharma, which they're trying to do, it means less access for patients. It means less affordability. It means less services that we're able to provide. And it means poor health outcomes.
Absolutely. And thank you so much for providing the specifics there. I mean, going from $450 some odd dollars down to $25 is a significant savings just for that one patient. A lot of people can't afford $450 a month just for their life-saving medication.
And April, if I could say one last thing, that same patient, he needed a $12 knee brace from Amazon that I asked him to buy then at the next visit. And he said he had to wait till his next paycheck because he couldn't afford it because he had blown all of his money on insulin. So he had to live in pain until he could get the knee brace because he couldn't afford $12 because he spent all of that other money on his insulin.
Yeah, and this means that people are making life and death choices while Big Pharma gets richer and richer every single day. Caroline, I'd love to go to you and ask the same question. What are some of the lesser known issues you're aware of in the fight against Big Pharma and industry price gouging? I think you're on mute.
Thanks. I think that, the extraordinary price of some of the drugs that people with metastatic breast cancer require is probably not well known. I know there are price issues with so many different kinds of drugs that so many people struggle with, but $15,000 a month is a cheap month with metastatic breast cancer. Drugs can run in excess of, up to about $40,000 a month for some drugs. So it's really extraordinary. It's just not possible to pay those out of pocket for, anybody but the 1% maybe, and I'm not even sure they could do it for long. So it involves all of us, because if you can't access that unless you have some type of health care, and whatever type of health care you have, it's impacting everyone's cost of health care. And so to just kick the can down the road, it does not eliminate that problem. It goes on to affect everyone. And it has a significant impact on everyone's access to health care. So a more sensible system of trying to address this and really, providing for the needs of people when they have a need, and also bringing our drug costs in line with the other parts of the developed world would just be a much more sensible approach to having people have access to what they need when they need it.
Absolutely. Those numbers are just staggering. I can't imagine paying $15,000 a month for anything, much less something that I need to keep me alive. It's
like trying to buy a car every month.
Right.
You can't do it.
Absolutely.
It's not possible. And this does have a really disproportionate impact on Black and brown communities. I was doing some research recently about the financial toxicity generally for people with metastatic breast cancer. But when you look at, people who can sustain themselves for periods of time with this disease, it's because they have resources to draw upon. And when you have no resources to draw upon, or very limited resources, the impact is just that much greater. And it's not something anyone should have to deal with, but it just ends up exacerbating other problems that we have.
That's an excellent point when we're talking about the disproportionate impact of price gouging in marginalized communities. I appreciate you making that point. Sarah, I'd love to turn to you and ask the HHS Secretary Alex Azars, the former CEO of Eli Lilly. Already, I'm seeing red flags, but he led the process of price gouging insulin out of reach for millions of Americans. And I know you use insulin as a diabetic. If you could speak directly to Azar, what would you tell him?
I would tell him that he has a lot of blood on his hands and that he is solely responsible for a lot of lives that have been lost because people cannot afford their life-sustaining medicine. And I believe it was in 2018, Eli Lilly made $9 billion off of diabetes medication alone. And they paid $0 in federal taxes. And so what they do is they buy their own stock back instead of like investing that money into lowering the actual prices. So it's just, I mean, if I could meet him, that's what I would say. It's just like I would give him a list of all the people, the names of the people that I know who have passed away from rationing their insulin. And the list is too long.
That's unbelievable. And we actually have a question, Sarah, for you from Arlene on Facebook. Arlene says she worked as a diabetes educator and her patients need critical insulin. And she went several times to the pharmacy and bought their medicine for them because they couldn't afford it, as Tarek was mentioning. Sarah, what are some of the workarounds you've heard of people living with diabetes have to make to get the insulin that they need?
Outside of just, let me start with myself. I have survived off of samples from my doctor. And I've also decided, am I going to pay my car note or am I going to get what I need to live? So a lot of people, millions of Americans are deciding, are they going to pay their lights? Are they going to get groceries? Or are they going to get their children's insulin? And it's just not fair to live in such a lucrative country to know that money, millions and billions of dollars are going in all these different places and people cannot afford what they need to live. So I know, like I said, from my personal experience, getting donations from people throughout my community, church, family, even just random people from, across the country. This is just an unfortunate way. And it's just sad. Like these are the measures that we have to take living in this country just to stay alive.
Tarek, I would love to hear from you on this. If you know of workarounds that patients are having to do, not just with respect to insulin, but any type of medication you mentioned. You mentioned the knee brace and having to wait until the next pay period, and the fact that some have to take several buses just to get the medication or the equipment that they need. Are you aware of workarounds that your patients have had to do to get the life-saving medication and equipment that they need?
Yeah, sort of like Sarah, when it ends up happening is that patients, they stop taking their medicines. I can't tell you how often it is that a patient, they run out of their they lose their health insurance and they just stop taking their medication. Because when you're uninsured, it's like prohibitively expensive. Even my patients that have health insurance find it hard to pay for the insulin. So what we end up doing is having really good relationships with the drug reps, right? So that we can get more and more samples from them because there's no other way that we can get this medication. So, other workarounds are changing the drug that really works to something that's less effective because that's all you can get paid for. A good example was Lipitor. As we know, Lipitor generally statistically works better than Zocor, but I would prescribe Zocor because I can get it for $5 instead of Lipitor, which is supposed to work better. So basically, patients end up suffering this. That is the workaround, pretty much.
It's horrible. It's infuriating. I'd love to hear from all of you. And let's start with Caroline. How can viewers get involved in the work that you're doing to push for affordable medicines and vaccines? Because if you are not a person that's directly affected, you know someone that is. So how can we get involved?
Right. Well, work with Healthcare Voter. That's why I've done advocacy as much as possible through them, because they're really working toward a HR 3, which is the Affordable Drug Act, and we need to work on that piece of things, and just other advocacy that supports access to a universal, meaningful, high-quality healthcare program, whether it's Medicare for all or something else, something similar. I think those are definitely key issues to support. I do a lot of advocacy specifically around metastatic breast cancer through Medivivor, which largely focuses on research, but also on ensuring access to healthcare for women and men with metastatic breast cancer.
Absolutely. Sarah, if we've got lots and lots of people online right now watching this, what would you say to them? How can they get involved right away in the work that you're doing to push for affordable medicine?
I would echo Caroline, definitely working with Healthcare Voter and not just sharing your story, but if you know someone else who has a story, getting their story out there. People, you kind of get caught up in the emotions of struggling and you don't really think that what you're going through is wrong, but no, this is wrong. You should not have to choose between your bills or food to get your medicine. So I would say Healthcare Voter, also Patients for Affordable Drugs and T1 International. Those are also two other organizations that help get people's stories out there.
Thank you for those specific examples. Tarek, I'm going to give the last word to you. How can people get involved with respect to the advocacy that you're doing?
I say that the most important intervention I can do as a healthcare provider is to actually get people to vote. A lot of people don't think that voting is that important in 2020, but what happens if Democrats lose this election, the ACA will be repealed and completely gutted if Trump is reelected, meaning that the Medicaid expansion our uninsured rate goes from not only from 10% to 25%, but higher than that because more people are expected to lose their health insurance. If you don't vote, it means 4 more years of judges that are right wing that are going to consistently side with pharma and against patients. It means 4 more years of attacks on providers like myself from the Trump administration. And it means billions more tax breaks for pharma, which, as Sarah mentioned, will go to stock buybacks. And it also means more pharma executives like Alex Azar in charge of our healthcare system. And then finally, it means 4 more years of people like our president and this administration that continue to put profits and politics over patients.
Thank you for that specificity. And Caroline, Sarah, and Tarek, I want to thank you all for your advocacy, for your vulnerability, and for inspiring all of us. Thank you for joining us today.
Thank you.
Thank you. Thank you, April.
Now we'll welcome a couple of experts to join us and tell us about what's at stake in the world of policy and lawmaking. Please welcome Margarita George, the campaign director for Lower Drug Prices Now, and Zain Rizvi. He is a law and policy researcher with Public Citizen. Welcome to you both. I am going to first ask both of you the same question I asked our guests before. What makes you a healthcare voter? Margarita, let's start with you.
Great to be here. I almost felt, April, like I just wanted to hear the last round of panelists keep talking because they had such amazing things to say. So I will say, for many years, from the time I was about 20 till I was 32, 33, my job was knocking on doors, organizing people around lots of issues. And what I noticed in all those years of organizing is that even when I would go to the door to talk to somebody about, education or to talk about taxes, the issue that almost everybody wanted to talk about was healthcare. It is really an issue that is central to people's lives. And I think it's because of what we heard from the panelists, which is it's really personal to people, right? Every day, people struggling, they can't take their kids to the doctor. Seniors in Medicare have to take up collections in their churches to get a tooth pulled. And so I have always felt like healthcare was really a linchpin issue. It is the linchpin of economic security. It is the linchpin of people's health and well-being, obviously. And that is one reason why I think I've continued to work on it now, 25 years later. And I consider it to be sort of the central issue. And I really couldn't agree more with what some of the folks on the last panel said. We are having an insane debate about healthcare in this country, right? These things in other places are not debated. We don't even have a discussion about public health in this country. Our discussion is about the financing of healthcare. So we never have any kind of discussion about what people actually need to live better, to feel better, to be able to have the kind of healthcare that they need to really enjoy their lives. And so my hope is that over time, we're going to get from a discussion that right now is focused on financing, and hopefully soon will be focused on how do we get profit out of healthcare, to a real discussion about how do we improve and provide the best health for everybody in the country so that people can live their lives and take care of their families and enjoy some portion of that.
I think you're exactly right, Margarita. I mean, this is a linchpin, as you said. If you don't have your health, you can't go to work. You can't take care of your family. Everything is based on that. And truly, we're asking some of the wrong questions, right? Because of the way that our system is currently set up. Zain Rizvi, please tell me what makes you a healthcare voter.
First, thanks for having me. I think Margarita just said it perfectly. I think health is at the beginning and end of everything. This is all we have, really. Everyone has a story. Everyone has a story of illness. Everyone has a story of suffering. Everyone has a story of what it means to not be in full health. And I think it's a great connector in that way. And it's one of those fundamental issues that should, in theory, bring us all together. Just as the coronavirus pandemic should have shown how interconnected everything is and the need to ensure, robust healthcare protections. Instead, too often, what we see is the opposite. We see all of the societal inequalities kind of reflected in our healthcare system. And in some cases, the healthcare system actually exacerbates those inequalities themselves. And so you see Black and brown people who suffer the most. And so in some way, healthcare is actually one of the greatest engines of inequality in this country. And the pharmaceutical industry is actually a perfect example of that.
That's exactly right. And I think the disproportionate impact is something that we really need to talk more about. Margarita, you lead a national coalition of organizations fighting for lower drug prices. And one of the main pieces of legislation that this coalition is pushing for is called the Lower Drug Costs Now Act, which Representative Omar mentioned earlier in our series today. Can you tell our viewers a few more specifics about this bill?
Sure. Well, I mean, one thing that polling tells us, and this really matches up sort of with what I know anecdotally from being a door knocker. When you ask most people in America, why is the cost of drugs so high? People will say, first, that almost everybody is right. And they will say the drug companies are very greedy. Absolutely true. That's the driver. Second, they'll say, well, we don't negotiate for the prices. Right, they're right. It's a central problem. And so there's very widespread support across both parties that we need to negotiate drug prices. The way the Department of Vets negotiates drug prices, the way Medicaid negotiates drug prices, it's just common sense. But instead we have a system where essentially the prescription drug companies in big programs like Medicare can dictate the prices. They just decide what the prices are going to be and charge us whatever they want. So this legislation, I think of it as a pretty overdue piece of legislation. We have been talking about it and working toward it for a long time. It would lift the ban on negotiations in Medicare, which is the health insurance program for aging people and people with disabilities. And that means that prescription drug companies would no longer have sole charge to decide what they're going to charge us, right? We would be able to negotiate with them for lower prices on a set of drugs. So it's a great first step because it covers a set of drugs. It doesn't cover all drugs. Those prices wouldn't just help people in Medicare, they would also be extended to people with private insurance, which is great, right? Because often we just heard from our panelists that even people with insurance can't afford the out-of-pocket cost for these drugs. They need to be lower priced. The bill does a couple of other cool things, hearkening back to what Representative Omar said. This bill already had an international price index piece to it, right? Where essentially the prescription drug companies would be penalized if they tried to charge people in the US more than people in other countries pay for that same drug. Now, of course, the president rejected the bill. He rejected negotiations. He rejected the International Price Index. Those were both things that he had committed to support. Fast forward this weekend, he does his own executive order, which probably won't go into effect for a very long time, if it ever goes into effect. The other really cool thing that the bill does, and one reason we like it, is because it generates a lot of savings from these reforms. And these savings get reinvested into healthcare so that it provides additional services for people in Medicare. Right now, people in Medicare, older people, people with disabilities, Medicare pays for a lot of things, but it doesn't pay for dental, it doesn't pay for vision, which is a little bit ironic because a couple things that you might need while you're aging would be, dental and vision. So the bill would reinvest in providing those services through Medicare. And it has a variety of other things. It's a great bill. We're working on that bill and we're working on the MAP Act. Those are sort of two really important pieces of legislation that we're trying to press forward between, now and the next couple of years, if hopefully we get the political change that we need.
Absolutely. Well, we will be definitely following closely to see what happens with that bill and the other work that you're doing. Zane, I would love to come to you for just a second. Ask, too many Americans don't know about just how much influence Big Pharma has on lawmakers, especially in Congress. Can you tell us some of the overreaches of Big Pharma's influence that you've actually seen?
It's hard to know where to start. One of the kind of classic examples, this is like, even way before my time, but essentially one of the lawmakers who helped make sure that there was a ban on Medicare negotiating drug prices, after he got the ban through, later that week, he joined the pharmaceutical industry trade group as their head lobbyist. And so he resigned his position in Congress and he switched over. So that gives you an example of just, how egregious some of these examples are. I think there's just so many stats. You look at the fact that there are more than twice as many pharma lobbyists as there are members of Congress. Or you look at the billions, like the hundreds of millions of dollars that the pharmaceutical industry puts into, campaign contributions, into or organizations, smaller organizations that support their viewpoint. And you kind of start to see the picture, right? You start to understand why there is such hesitation to take the bold action we need to lower drug prices. Margarita provided a great summary of HR 3. And one thing to point out here is that HR 3 was also the most ambitious drug pricing legislation that we've had so far, that has passed the House. Of course, a lot more needs to be done, but the fact that it went through the House and we had, a Medicare negotiation bill was really a remarkable feat. And the fact that it hasn't gone anywhere ever since is unfortunate because it could help a lot of people.
That's exactly right. And that's the goal, to help as many people as we possibly can. I just saw a really sweet comment on Facebook from Arlene that I wanted to share with you all. Arlene says, "Thank you for this webinar. I am praying for our patients every day." Thank you for that, Arlene. And we're all thinking of everyone right now facing medical hardship, especially in the midst of this pandemic. I want to thank you, Zane and Margarita, for joining us today, along with all the other great speakers that we've had. And before we conclude, I'll come to you, Margarita, first. Is there anything else you want to share with us that we did not cover today?
The thing that I would like to share is just that, on this issue of prescription drugs and who sets prices, to me, it's an issue of fundamental democracy. This is the richest country in the world. In comparison to some other countries, it's 10-fold, 20-fold, 30-fold as rich. We have ample resources. There is plenty of money. We are struggling with this pandemic, but not everybody's struggling. Right? We actually have 29 new billionaires during the course of this pandemic. Some people are doing just fine. The prescription drug industry is doing just fine. There is plenty of money to solve this problem. So we should not buy these prescription drug sob stories about how everything's going to go to hell and they'll never make a new drug if we're going to, force them to actually give taxpayers a fair return on the investment. This is our pooled money that have developed most drugs that could save millions of lives here and around the world. The issue of democracy is that we ought to force these legislators to deploy our money for the things that serve our good, that serve the public interest. So to me, it's obviously an important healthcare issue. It is a bigger issue that is just fundamentally about redistribution and democracy. And we should think about it and fight for it that way.
You're exactly right. And, the word that keeps coming back to me is infuriating. We should not be talking money. We should be talking about health care for American citizens. And to think that people are getting rich off of the deaths and the dying of American citizens and the fact that it's preventable, I just don't have words, definitely words that I can't use on Facebook. That's exactly how I feel. Zane, I'd love to hear, is there anything that you want to share with us that we did not cover, and maybe even, something a little more inspirational about where do we go from here? What do we do next?
Maybe I'd like to conclude maybe a short story. Truvada for PrEP is medicine that could help prevent HIV if it's taken regularly. And federal scientists actually at the CDC were the ones to discover that Truvada had the effect of preventing HIV, that could use it as PrEP. We found that out in 2011 basically, and Truvada as PrEP launched a couple of years later by a company called Gilead. The list price for that drug was $2,400 a month. And as a result, the CDC actually just came out with a study today that concluded that only 20% of people who would have benefited from Truvada were on Truvada. And one reason for that was the exorbitant price of Truvada. It's a perfect example of just how skewed the drug development system is, where literally the taxpayers are funding the development. Literally, taxpayers are running the expensive clinical trials. Literally, the taxpayers are doing the science, and then we hand it off, and these large pharmaceutical corporations are able to rip us off, and it has a disastrous effect on our healthcare system. If you look at HIV, if you look at where the epidemic is growing, you know that it's growing in Black and brown communities in the South. Mm-hmm. It is unconscionable that the federal government has not taken more steps, even basic things, just require reasonable pricing on federally funded inventions. It is unconscionable that the government hasn't done that, and we keep seeing the devastating effect. And so it all sets it up for what's going to happen with the coronavirus. What happens when we hopefully get a new treatment and it turns out to be thousands and thousands of dollars. In terms of inspiration, I think the good news is that it's obvious. It's so simple. It's if you're awarding someone a monopoly, you should get a say. You should be able to set the price. You should be able to at least negotiate the price. And as long as we give these corporations a monopoly control, they're going to do this. And the good news is that we can fight back. And that really, it's an entirely preventable problem. And that is both infuriating and that is also inspirational, because it's one of the few things that's entirely under our control, and we can totally stop this nightmare if we wanted to.
And how would you suggest the people that are watching this now, for both of you, how would you suggest that we fight back? Is there one thing that we can do that you feel will really make a difference? Margarita?
Well, I'm going to have to harken back to Tarek's comment that people need to go out and vote. Right? Like, democracy is about every single individual participating and, vote on the issues that are important to you and participate and be clear. Because if we can't change decision makers, we are not going to have the opportunity to solve this problem that, as Zane is pointing out, we know how to solve, and it's totally solvable. There is no mystery. We don't need to do a whole bunch of research. We don't need 25 PhDs. We know how to solve this problem. So it's really important for people to participate in this election and really do everything that they can to ensure that we have the kind of leadership that's willing to take on these issues and that is willing to take on pharma, for the betterment of the country and to save people's lives.
That's exactly right. We need to register to vote. We need to vote early. We need to ensure that we know where our polling place is. If we're requesting an absentee ballot, we need to do that early to make sure that there is no question about whether our vote is being counted and when.
Right. One other thing I would say, April, that I think is really important, and there's going to be a lot of effort to persuade people that voting doesn't matter, right? That is to take people's hope that it doesn't matter. There's nothing we can do. Voting doesn't, it's not important. And it's really important to battle through that, right? If it didn't matter, they wouldn't be trying to persuade you not to do it. So, really, I really appeal to people's conscience on that matter. It matters. It matters if you vote. And you know what? It matters if you don't.
That's right. And we have to do it for the better good of the entire country. So even if you're not incredibly enthusiastic, you should still, use your right to vote if you have that ability to do so that we can make change, not just for ourselves, but for our communities and for the country at large. Zane, I'd love to end with you. Is there one thing that the people that are watching today can do other than registering and ensuring that their vote is counted to make the changes that we need to see?
I think one of the critical issues is just recognizing and owning the incredible work that the federal government does. There are these federal scientists who are on the front lines of innovation and who are pushing forward medical science. The US government spends $40 billion just through the NIH alone in advancing medical innovation. And so I think it's really important for everyone to just understand that fact, and when we talk about drug prices, when we talk about healthcare, we understand that it is we, the taxpayers, who are driving so much of this forward, and we can choose to do things differently. There is no reason why the US government, which is the largest funder of biomedical research in the world, is compensated for its investment by being charged some of the highest drug prices in the world. That is the opposite of the art of the deal. That is the worst deal I've seen. And so we can do a better deal, basically.
Absolutely. Well, we already know the current administration isn't good at negotiating anything. So what we really need to take more control back into our own hands so that we can make the changes that are going to be the best for the citizens of this country. Margarita and Zane, thank you both for joining us today and sharing your expertise. I know I learned a lot, and I'm sure our viewers have too. So thank you again.
Thanks to you, April.
Yeah.
Join us next week for another Instagram Live conversation with Anushka from Healthcare Voter and another special guest. I joined Anushka last week and we had a blast. You'll want to tune in this week as well. This Instagram Live will discuss how Big Pharma price gouged insulin out of reach for millions of diabetics and what needs to be done to fix this. Thank you everyone for joining us, and we'll see you next week right here at 6 p.m. Eastern Time.